Kevin Durant is one of the best basketball players in the world. He has dominated the NBA for years and won 2 championships with the Golden State Warriors. However, in 2019, he suffered a torn Achilles tendon in Game 5 of the NBA Finals against the Toronto Raptors. He had been dealing with a calf strain prior to the full rupture and has actually not played basketball at all since the injury. Durant sat out the entire 2020 NBA season, and people have been starting to wonder, is this normal? When will he return? When he comes back, will he be the same as he was before? Welcome back, sports fans. If you're not familiar with my channel, my name is Nick Gallo and I'm a doctor of physical therapy. Today, I want to take a close look at Kevin Durant's Achilles injury that ended his run in the NBA Finals against Toronto in 2019. With today's video, I am first going to take a look at the actual injury video that we have of Kevin Durant hurting his Achilles tendon. Then I want to go over some of the anatomical structures that are involved with this type of an injury. And finally, I want to go over an appropriate time frame for someone that has this type of injury. If you like today's video and you find it informative, please hit that subscribe button and give the video a thumbs up, because I will be making more content on this channel when it comes to sports injuries, rehabilitation, and other physical therapy related content. Now first, let's take a look at the actual injury itself. Here we see Durant has the ball and he starts to drive. As he pushes off that right leg, he hobbles to the side and doesn't put any weight through that leg. We see him sit on the floor and we can see him here feeling around in that right Achilles tendon area. He's trying to move his foot around, but he knows something's wrong, so he immediately calls the medical staff over. Here's a closer and slower view of Durant pushing off that right leg. We can see here that it looks like something in his right leg snaps as he goes to push off. This seems to be the exact moment that he did rupture his right Achilles tendon. The Achilles tendon is formed by 3 muscles in the calf musculature. These are the gastrocnemius, the plantaris, and the soleus muscles. The Achilles tendon is also sometimes referred to as the calcaneal tendon because it's going to attach to a bone known as the calcaneus. If you are feeling on the top of the heel as shown and you move your fingers upwards, this is where your Achilles tendon is located. The 2 primary motions of the foot that the Achilles tendon is involved in are plantar flexion and dorsiflexion. Plantar flexion is seen on the left, and that is the act of pointing the toes down. This is engaging the calf muscles and also the Achilles tendon. Dorsiflexion is the act of bringing the toes upward and is visualized on the right. In this position, the calf musculature and the Achilles tendon are in the stretched position. If a person is in the dorsiflex position and goes to push off, this puts a lot of strain through that Achilles tendon. This is a fairly common motion and does not always lead to rupture. However, in Kevin Durant's case, it did. About a month prior to the Achilles tendon rupture, Durant had suffered a calf strain against the Houston Rockets. This strain was caused by him driving to the baseline and performing a jump shot. It's very possible that having a prior injury to the same leg within that short amount of time may have also led to the rupture as well. But it's important to note that Achilles tendon ruptures happen even if there is no prior injury. So to recap, Kevin Durant suffered a full tear of his Achilles tendon, and this is pretty evident by that slow motion clip that we see of him hurting it. The Achilles tendon is made up of all the calf musculature, which include the plantaris, the soleus, and gastrocnemius muscles. Rupturing of this tendon can occur when enough force is placed through the tendon when the foot is in that dorsiflex position, which is exactly what we saw with Kevin Durant's injury. If a person is also dealing with any type of Achilles tendonitis, this can also lead to a full rupture. Since Durant had been dealing with that calf strain prior to this injury, it is possible that he had some inflammation in the area, and that may have also played a role in him tearing the tendon. Now, the calf musculature and the Achilles tendon are all involved in a motion at the ankle known as plantar flexion. Plantar flexion is the position known when a person is going to point their toes downwards, or if somebody is doing something like a calf raise. Now, a quick test that can be done by the medical staff to determine if somebody has in fact torn their Achilles tendon is known as a Thompson test, and this involves them squeezing the muscle belly of the calf and seeing if that foot goes into that plantar flexion position. If they do squeeze the calf muscle and the foot goes into the plantar flexion position, then a full rupture is not typically seen. However, if the medical staff squeezes that muscle belly and the foot does not move at all, then this is a sign of a full rupture. But it is important to note that the gold standard for diagnosing an Achilles tendon rupture is, of course, the MRI. Now, typically after a full Achilles tendon rupture and surgery, a person can return to sport-specific movements at about 7+ months. But it is really important to note that Achilles tendon injuries really do take a long time for a person to make a full recovery, because it just takes a long time for them to gain strength in that leg.
One of the things that a person is really going to work on when in physical therapy towards the end is a single leg calf raise. And personally, I've seen patients that still struggle with that up to a year or more out of surgery. Also, since the sport of basketball involves a ton of running and jumping and positions where that calf muscle is going to be utilized, I expect Kevin Durant to go through a ton of sport-specific training in order to make sure that he is appropriate to suit up again. Now, I do expect that we see Durant make a full recovery from this injury because, of course, he's on the younger side and he is a professional athlete, so he has unlimited resources when it comes to his medical care. And I also think that if he has no other mishaps or anything like that, that he will play the full season next year. Although I do really wish Kevin Durant a lot of luck because this is a tough injury to come back from, and it's really a tough injury from a medical provider standpoint to rehab somebody because it can just take a long time. And that's it for Kevin Durant's Achilles injury. Thank you for watching. Once again, if you really liked today's video, please subscribe to the channel because I will be making more videos. Thank you for tuning in, and I'll see you next time.